I'm over here. I've been sitting through this hearing all day today and have noted that you've been unable, in most instances, to answer any specific questions relating to your agency.
Because I haven't been given time.
That particular division, what you plan to do in
There's 42 divisions on maternal health we consolidated.
Sir, let me finish what I'm saying here. The fact of the matter is you have dismantled it as we speak. And are you aware, what does the assisted reproductive technology mean to you? Are you familiar with that?
Are you talking about IVF?
A mistake? I've heard you say you've made some mistakes today. Was that also a mistake?
We switched those programs to the Administration for Healthy America. They have not been cut.
In a tense Senate hearing, Senator Brooks sharply criticized Health and Human Services Secretary Robert F. Kennedy Jr. for being unable to answer key questions about his agency's programs. Brooks accused Kennedy of firing scientists and cutting funding from critical divisions, including the Safe to Sleep campaign, which helps prevent infant deaths, and the CDC's National Center on Birth Defects, which supports the Special Olympics. Kennedy denied the claims, insisting that no scientists were fired and that the programs were not eliminated but rather consolidated under his new administration for Healthy America. The senator also challenged him on dismantling the Division of Reproductive Health and on his apparent lack of familiarity with assisted reproductive technology programs like IVF. The exchange underscored growing tensions over Kennedy's leadership and his sweeping restructuring of long-standing public health programs.
Senator Alsobrooks.
Thank you so much, Mr. Chairman. Mr. Secretary, I'm over here. I've been sitting through this hearing all day today and have noted that you've been unable, in most instances, to answer any specific questions relating to your agency.
Because I haven't been given time.
Well, no, you have been given time, but the point of the matter is you've been unable to answer specific questions. Sir, you are the wrong person for this job, and you had in this hearing today the unmitigated gall to say at the beginning of your testimony that China is ahead of the United States in healthcare because China does not have DEI.
I didn't say that.
Well, we can roll back the tape. You absolutely did.
And you will find I didn't say that.
That is absolutely what you said.
I was talking about science, and I didn't say they're ahead of us. They're ahead of us in some forms of science, certainly not in healthcare.
Well, we can roll back the tape, but nonetheless, let me go on with my questions and ask you this. You just heard about the Safe to Sleep campaign, and you have made cuts. You made it very clear here today. You have no knowledge whatsoever of the absolutely amazing scientists and researchers who you have callously fired. You know nothing about the cuts.
You didn't fire any working scientists, Senator.
That, sir, is not true either. But nonetheless,
it is true.
It is not true. Let me ask you another specific question. The Safe to Sleep campaign, well, then can you name, sir, which office the Safe to Sleep campaign operates out of?
Which campaign?
Well, that's the one that the senator just asked you about 2 minutes ago that prevents babies from dying in their sleep. A 30-year program inside your agency. You would agree that it's important.
I think it's part of HRSA. Or ACF, it's ACF.
No, actually, it's in Health and Human Services.
Yeah.
And I think, and again,
no, they're all within Health and Human Services, but the subdivision is ACF.
No, actually, the name of the
Administration of Children and Families.
No, let me tell you what it is. The National Institute of Child Health and Human Development. This is actually the one that your aunt, Eunice Kennedy Shriver, is the person who it's named after. And you noted just a moment ago, the senator reminded you that although this is a very important agency, prevents babies from dying, this is the same one you fired every single person in this office as of April the 1st. It is also—
As I said, there were no working scientists fired during the RIF.
We can bring you that information later, but because what you just said is not true. Well, then the question also is, in addition to firing the individuals who make sure babies don't die in their sleep, why did you cut funding and staff from the CDC's National Center on Birth Defects and Developmental Disabilities, which supports the Special Olympics? Was that a mistake? I've heard you say you've made some mistakes today. Was that also a mistake?
We switched those programs to the Administration for Healthy America. They have not been cut.
Well, the funding has been cut, and this is one that oversaw the Special Olympics. Are you aware of that?
We have not cut the Special Olympics.
You've cut the funding, and you also dismantled the Division of Reproductive Health and Women's Health and Fertility. You're aware of that, right?
We have, right now, we have 42 divisions that do maternal health, and we're consolidating them. And the mainstream media has portrayed those as cuts, but they're not cuts, they're consolidations. It's ridiculous to have 42 divisions that are all supposed to be doing the same thing with their own administrators.
Well, let me ask you a question. So it doesn't exist right now, it's been dismantled. That is a fact, that particular division, what you plan to do in the...
There's 42 divisions on maternal health we consolidated.
Sir, let me finish what I'm saying here. The fact of the matter is you have dismantled it as we speak. And are you aware, what does the assisted reproductive technology mean to you? Are you familiar with that?
Are you talking about IVF?
Well, it's assisted reproductive technology. It's a division. Do you know what it does?
Is it part of NIH?
No, it's actually a part of your agency. It's a part,
NIH is part of my agency, Senator. You should know that.
I do know that, but it's actually a part of, it's the CDC is where it is.
Okay, then it's CDC.
Right, okay. Let me just ask you, and again, these are all of the things you seem unfamiliar with, the ones, the programs that you've cut.
You're unfamiliar with my agency, that NIH and the CDC are part of HHS.
Oh, I absolutely know. NIH is in my county. I was there this past weekend with the researchers that you have fired. So I absolutely know where NIH is, sir, and don't need any help from you in knowing that. I see the time. Thank you.
Senator Blunt.